Taoiseach, I want to raise again the heartbreaking case of Ava Cahill, an 11-year-old from Tallaght. She has spina bifida, which results in her feet being turned inwards, making everyday tasks very difficult. Putting on her shoes on a daily basis is a challenge. She needs help to put on her trousers, and she has been left waiting for over a year and a half for corrective surgery, with her condition worsening on a daily basis. Can you imagine what it's like for her and her family? They don't even have a date for surgery to look forward to. Worse still, if the condition continues to deteriorate, it could end up being inoperable. And she is just one of 649 children waiting for surgery, including 56 children with spina bifida. It's a national scandal, Taoiseach. And your earlier response seemed to suggest that it's not the government's problem. Sure, the hospitals have the funds, why don't they just go and do it? But I would put it to you that that doesn't make any sense. We need to provide the resources to clear the waiting lists rapidly and to build a top-quality Irish National Health Service.
I'll raise again the issue of Ava Cahill and the orthopaedic situation. Government is responsible overall for the delivery of healthcare. The point I was making earlier, the funding has been allocated, and a figure of 5 million is not an issue. Just to make that very clear. And you know, since 2018, before I came into office, to be fair, an extra 9 million had been allocated each year to the HSE, specifically for the funding of orthopaedic services. This additional funding supported the recruitment of approximately 60 extra staff in 2018 and 2019 to enable the expansion of paediatric orthopaedic services. Now, improving capacity to allow for additional activity is obviously the key enabler to improve waiting times. And proposals by the HSE under the waiting list action plan they have funding to extend theatre capacity in Crumlin and Temple Street, additional theatre capacity at the National Orthopaedic Hospital at Kappa since April of 2021 for day case surgery. CHI has advised that this should result in a positive impact in reducing long waiting times for general orthopaedics, in addition to consequential capacity gains for scoliosis patients. In 2022, CHI is planning to undertake a range of inpatient, day case and outpatient orthopaedic appointments in Kappa. Planning for additional orthopaedic scoliosis theatre sessions using private facilities supported through HSE procurement agreements is also there. Huge funding has been provided to the health service, both in 2020 during COVID and 2021. I mean non-COVID health expenditures. There was a 600 million allocation in the winter of last year, given very early, with a view to making sure that capacity would be increased right along the line. And we have said repeatedly to the health service operators, where you can get capacity quickly, be it theatre capacity, be it bed capacity, please go and do so, and recruiting staff. I mean, a record number of staff was recruited last year because of that extra funding. Less than they said they could recruit. In other words, or that they were hoping to recruit. They had resources to recruit more last year, the health service had, but because of obviously there's a huge demand on key physicians and so on. They were not in a position to recruit as many as they would have liked to, but they still managed to recruit a record number in any one year, and likewise in 2020 the same. But that said, look, as far as I'm concerned, anything that can be done to make sure that Ava gets her operation and other children are not waiting in any way and in an inordinate length of time has to be the priority. It's not funding. They need to really get the capacity in place and do whatever it can be done in the shortest possible term to get it done. I have